Hello everyone. We are going to study fixation and fixatives in histopathology. So fixative is a substance which prevent post-mortem changes and that preserves the morphological and chemical characteristics of cells and tissues. And fixation is the foundation for subsequent stages in the preparation of the sections through the making of diagnosis. Aims of fixation are to prevent process of autolysis and bacterial attacks, to maintain the shape and volume of the tissue during any of the subsequent procedures, to enable clear staining of the sections, and to maintain the tissue to as close to their living state as possible. So chemical classification of fixatives, they could be aldehyde based, oxidizing agents, protein denaturing agents, cross-linking agents, or metallic salts. So the aldehyde fixatives are formaldehyde, which is most commonly used, glutaraldehyde, which is used in electron microscopy, chloral hydrate glyoxal. These are aldehyde fixatives. Oxidizing agents, they are potassium permanganate, potassium dichromate, and osmium tetroxide. Osmium tetroxide is also used in electron microscopy. Protein denaturing agents like acetic acid and methanol, they are also used as fixatives. Carbodimide is a cross-linking agent, and metallic salts like mercury chloride and picric acid, they can also be used as fixatives. Fixatives for electron microscopy are glutaraldehyde and osmium tetroxide. Physical fixatives are heat, microwave, and freeze drying. So we can fix the tissue by heating, microwaving, or freezing. So how the fixatives act? The mechanism of action. Fixatives have the property of forming cross links between the proteins, thereby forming a jelly, ideally keeping everything in their in vivo relations to each other. So by forming cross links, they form jelly like material. Soluble proteins are fixed to structural proteins and thus rendered insoluble. So soluble proteins, they are rendered insoluble and whole structure given some mechanical strength which permits the subsequent manures to take place. Fixation normally takes place in aqueous solutions. Occasionally vapor is used. Factors that affect the fixation. First is pH. Satisfactory fixation requires pH between 6 to 8. Second is temperature. Surgical specimens, they are fixed at room temperature. Higher temperature will cause tissue distortion and autolysis, whereas lower temperature, it will reduce the rate of fixation. Penetration of fixative is also important. Depth of tissue penetration is directly proportional to the time. Then duration. Prolonged fixation in formalin will lead to secondary tissue shrinkage and inhibit enzyme activity and immunologic reaction. Primary fixation usually takes place in 2 to 6 hours in buffered formalin. Osmolality of fixative solution is also important. If the solution is hypertonic, it will lead to cell shrinkage, and if it is hypotonic, then cellular swelling will occur and lead to poor fixation. Secondary fixation or post fixation. Sequential application of two fixatives is known as secondary fixation. The primary fixative, whilst not being totally effective, leaves the tissue more able to withstand action of second, harsher fixative, bringing benefits in more brilliant staining. So first specimen fixed in buffered formaldehyde, then subjected to secondary fixation with HgCl2 formaldehyde. Disadvantage of secondary fixation is extra cost is required and the toxicity of the material used. Mercury is used, so it is toxic. Now there are some artifacts of fixation. Fixation may lead to false localization. The unfixed material may diffuse into the tissue and come to rest at a place other than its original location, leading to false localization. Diffusion of materials outside the tissue may occur. Formalin pigment produced under acidic condition. False fixation of extraneous material to the tissue. And the aldehyde, it may induce fluorescence in the tissue. So we are going to discuss formaldehyde. Formaldehyde is a widely used general purpose fixative for tissues to be processed for paraffin embedding. It is a gas commercially available as 40% solution in water. So it is available as 40% formaldehyde. This saturated solution is termed as formalin. So 40% formaldehyde is formalin. 10% neutral buffered formalin is prepared by using 100 ml of 40% formaldehyde, then distilled water 900 ml, and sodium hypophosphate and potassium hypophosphate are also added. The pH is maintained at 6.8 to 7. Fixation by formalin. Gross tissues are cut in blocks not thicker than 6 mm and they are placed in 20 volumes of neutral buffered formalin for 24 hours. At the end of first 24-hour period, the tissues are changed to the fresh fixative for additional 24-hour period. Fixation is usually complete at the end of this 48-hour period and tissues are ready for processing. If the tissue sections are thick or dense, longer period of fixations are required. So mode of action. Formalin has ability to add itself to side groups of certain amino acids. Glutamine, lysine, these are important. Other are cysteine, histidine, arginine, and thereby denature the protein and render it insoluble. Methylene bridges are commonly formed between similar groups, but they are reversible by washing with water. If they are washed for 24 hours, it removes 50% of the reactive groups. Washing for 4 weeks will remove up to 90% of the reactive groups that are methylene bridges. During long storage of formalin, especially during the cold, concentrated formalin may become turbid due to formation of white precipitate of formaldehyde. It should be removed by filtration without affecting efficacy of formalin. So it is removed by filtration and it will not affect the efficacy of the formalin. These are paraformaldehyde. Formic acid. Traces of formic acid, they are normally present in the commercial solutions of formalin. And formic acid tends to be formed in all formalin containing compounds by oxidation. So this formation of formic acid will increase the acidity, that will reduces the quality of nuclear staining. And this formic acid further bring out the hemosiderin, leaches out the hemosiderin and promotes formation of formalin pigment. It should be guarded by using the buffered formal saline with pH 6.8 to 7 or by adding magnesium carbonate and calcium carbonate to the formalin solution. Artifacts in formalin-fixed tissues in histopathology sections we see are ground glass nuclei or optically clear nuclei in papillary carcinoma thyroid, perineuronal space in CNS, and lacunar RS cells in Hodgkin's disease. They are also the artifacts due to formalin. So, advantages of formalin: it is cheap, easy to prepare, and relatively stable. If buffered, allows subsequent application of advanced immunohistochemical techniques. Staining for fat can be carried out if formal calcium is used, if calcium is added in formalin. Some enzymes can also be studied if formalin is fixative. Frozen section can be prepared with great ease from formalin fixed material. Disadvantages of formalin is it may cause dermatitis and it is irritant to nose. So a ventilated area is usually preferred. Tissues containing much blood. Unbuffered formalin leads to formation of dark brown pigment granules of acid formaldehyde hematin. Methanol, which is added to formalin to retard decomposition of formic acid, has denaturing action on proteins and so unsuitable for electron microscopic study. So when formalin is used, the disadvantage is formalin pigment is formed. So how to remove this formalin pigment? There are three methods. First is Cardeswich methods. First, bring the sections to the water, then place for 5 minutes to 3 hours in the given prepared solution, 70% alcohol 100 ml and 28% ammonia 1 liter. Wash thoroughly in water. Second method of removal is Lily's method. Bring sections to water. Place it for 1 to 5 minutes in the solution containing acetone, H2O2, 28% ammonia water. Then wash in 70% alcohol and then wash in running water. Method of removal of formalin pigment is picric acid method. Bring the sections to the water. Place for 5 minutes to 2 hours in saturated alcoholic solution of picric acid. Then wash thoroughly in running water for 10 to 15 minutes. That's all of fixatives. Thank you.